treatments are driving people away from the hospitals, and calls have been made to authorities to ensure hospitals are capacitated for the burden to reduce.
It is often said a picture tells 1,000 words, and this picture symbolizes hope, faith, and life, showing that there is light at the end of the tunnel. Cancer is vicious, and many have succumbed to this dreaded disease. Some have, however, survived the scare. For Florence Tarua from Mutare, mother to 4-year-old Tanatswa, who battled leukemia, presenting to hospital early can save a life.
Mwana kana arwara ngatisanyanye kumhanyira kumaprofiti kana kumanganga, hakuna chinotibatsira. Ngatimhanye kukliniki. Wekukliniki wakuzivawo mastage avanotora. Ukaenda pakliniki ukabviswa ukaenda zvakaita kwaMutare hospital, vanokutora masikana avanotora utumira mablood kunoku, akabva kuno mablood aya vanenge vachiti chiendai mundorapwe mwana. Mukakasikawo nemwana zvinobatsira. Wana havatiri kuziva wana vakawanda nekuti wana vari kuparara mumamisha nenyaya yekushaya ruzivo.
The battle with cancer can be strenuous, that one easily loses hope. But fighting partners such as Kids can revive the fighting spirit.
Pandakatobva kwaMutare ndakatoti makundiendesa kure, mwana uyu hakuna kwandichasvika naye. Asi madhokota akanditi aiwa, tikutsvaga kuti tibatsire mwana. Kana mati hamuna kwamuchasvika naye, suti akuti endai mberi une maspecialist dhokota pamwe zvinogona kutibatsira. Zveshuwa ndakatanga kurapirwa mwana wangu nadhokota Kadzinga. Ndo ndakasvika varipo. Vati mama amanonoka nemwana. Tasaya kutoita zvimabhora mumusoro nemumutsipa. Takuedza. Hatitarisiri kuti tinomuponesa, asi takuzamawo. Zveshuwa wakazama, tichibatsirana. Mishonga yeKidzken yandakabatsirwa neKidzken yakawanda. Mari yanga yakataurwa ipapo ndandisikaigoni. Asi wakandibatsira nemishonga yese yandakatanga kubaisa mwana wangu yeKidzken yakandibatsira. Wandibatsira kudaro zveshuwa ndakaona mwana wangu pakaita change.
Costs associated with battling the disease are high, and this is something keeping people away from hospitals.
Wakasvika pakutengesa mombe dzadziri mudanga dzese dzakapera, mbudzi dzese dzakapera, tingobatsirana neKidzken nababa wacho neKidzken nababa wacho. Kubva ipapo akabayiwa treatment yake yekutanga 5 pages dzikapera. Asi peji rimwe racho ndakazviverenga ini, peji rimwe rinenge chida $450 peji 1. Kuzoti imwe mishonga wayo anenge achinyorwawo yemarwadzo nezvimwe zvakasiyana siyana, nogona kusvika 500 papeji rimwe.
Calls have been rising for authorities to intervene in this fight against cancer. Specialists say the cost factor cannot be ignored.
Cancer medication is very, very expensive financially. When we talk of finances, you talk about scans. The scan can be as much as $900, especially when you're having the MRIs. So it is an expensive disease. It's very, very expensive.
This has driven people to spiritual and faith healers, which has compromised the treatment process. At Kids Can, they have since started engaging religious groups on the fight against cancer.
We're also encouraging them to seek medical help, not to stay in their sect and reaching out to the spiritual healers to look after the children who've got cancer. But first, it's important to give them the facts. What is cancer? The symptoms, and then ask them to react, to bring children, for care.
The battle with cancer is not an easy one. It requires a lot, financially, emotionally, and for it to be won. With necessary support, lives can be saved.
It is indeed true. We must not go and seek for help at Nganga and things like that. Just as rightfully as the mother had said that she went straight to the clinic and she got help and stuff like that. Obviously, it is very expensive, but if with help from Kids Can, it's looking quite bright for the kids with cancer.
Yeah, and I think it's also very important that our health system continues to be capacitated.
Yeah.
I think it just feels, growing up, it didn't feel like cancer was a thing. I'm not saying it wasn't there, but I think the awareness around this has become greater. But I think it's not just about the awareness at this point. It's also making sure that it is affordable and people understand that the earlier you get it treated, the better. Especially, I think it's even more heartbreaking for me when I think about young kids and how devastating cancer can be, especially even if you do go through the healthcare system, things like chemotherapy and all that stuff.
Like it takes a toll.
It takes a toll. So I think the more information that's out there, but more importantly, the more our healthcare system is capacitated, I think the better for everybody. So, I mean, kudos to Kids Can for the fantastic work that they have been doing and continue doing.
Right now we move